Welcome back to NHI Chat. I'm joined by the Medical Director for the National Health Insurance of the Virgin Islands, Dr. Harlan Vanterpool, here to discuss the Disease Management and Wellness Program. Remember the name, you're going to hear it for a lifetime. I know they say it's all in the name, but Dr. Vanterpool is here to break down the purpose of the program as well as your role. Dr. V, let's get straight into it. Let's tell our beneficiaries what the Disease Management and Wellness Program is all about.
Thanks, April. Good day, beneficiaries. I'm here to just give a brief synopsis of our Disease Management and Wellness Program that we hope to implement early in 2018 for the benefit of all the beneficiaries, which are you. The purpose of our Disease Management and Wellness Program is to, one, help persons with chronic diseases better manage their disease, to ensure that they have a better quality of life, and that by extension, they control and manage their disease appropriately. And the other part of the program is a focus on wellness, meaning that we want to prepare individuals to understand that once you put everything in life in balance, etc., exercise, your mental well-being, your physical well-being, etc., you become a much more balanced, equal person. And that's what we want to achieve here.
Excellent. Well, you and I have been talking for quite some time about being our better selves, especially in 2018. I think this is an opportune time to launch a program like this where a lot of persons are making their New Year's resolutions to be a healthier person. But you said something earlier about management of their chronic conditions. Let's break down for our beneficiaries again exactly what are chronic diseases.
Well, in our population, the top 5 diseases, as the statistics have shown, hypertension, diabetes, rapidly increasing numbers of cancers. We also have quite a few cardiac diseases. People are getting heart attacks, etc. And of course, our kidney diseases that round out the top 5 reasons that patients present with chronic disease.
Okay.
And to combat those, especially hypertension and diabetes, we know that diet is essential. We know that exercise is important. We know that managing our stress levels are critical as well. And also, we know that our lifestyles contribute significantly to we're more sedentary than before, we're not as active as before, and all of these are contributing to poor disease outcomes.
Exactly, and just to add to that is we're also in very demanding roles, so we're a lot more stressed than we should be. But Dr. V, give it to us straight. We've heard about programs similar to this being launched in the past. We as individuals, of course, know the basics in terms of healthcare and what have you. But what would you say makes this program, the Disease Management and Wellness Program, so different? Why do you think it'll make an impact?
Well, first of all, the program is not designed to basically control persons' habits, but to empower you to be able to better self-manage, and along with guidance given, prepare yourself for a better, healthier lifestyle. Okay? We want you at the end of the day to take charge and take control. So we're gonna be working with within and without. We're gonna reach out to other agencies, etc. And we have a comprehensive approach to an integrated approach to how we're going to promote health and wellness in our country.
Excellent. So, now talking about what we expect from our beneficiaries, there's a specific task that we want them to undertake in the coming weeks. Let's talk about the health risk assessment.
Yes. In the implementation phase of the program, we're going to be conducting what we call health risk assessments, which is a series of questions aimed at teasing out what are the exact health seeking patterns among beneficiaries, whether or not you take enough time for stress related activities, whether or not you take enough time for leisure, what are your eating patterns, your exercise patterns, etc., etc. And at the end of the day, what we do is to assimilate a risk of that's involved with that particular individual. So whether it's be a high risk, medium risk, or low risk for chronic or sedentary disease, that's what we want to determine. And then of course, as we identify the persons most at risk, then we're going to target those persons for the initial phases of the disease management side of the program. So we're going to focus on helping those persons to better able to control their diet, exercise, etc., and give them the necessary support to manage their diseases much better.
Excellent. Well, also even before the interview started, we were discussing also even prevention in some cases where you may notice some trends and nipping it in the bud even before they become chronic. So I love it. So that's going to happen in the next few weeks. What else do you have to say before we wrap up today's program about the disease management and wellness program? What word do you have to say to our beneficiaries who are going to be looking out for it soon?
Yes. Well, one thing I want you to do is to embrace and take advantage of this opportunity. It's an initiative of the NHI, partnering with the Social Security Board and other organizations in the country that are responsible for ensuring that healthcare is a priority. And I want to say special thanks to all our partners, the Ministry of Health, etc., in helping us foster this relationship that we want to have with you, the beneficiary. I think it's essential more than ever for us to ensure that we have a healthy population going forward and that we take healthcare as a serious priority.
Excellent. Thank you, Dr. Vanterpool. And the Disease Management Wellness Program, as Dr. Vanterpool indicated, is coming from the National Health Insurance of the Virgin Islands, geared towards improving health outcomes in the Virgin Islands. Now, the program will be launched under the theme Be Healthy, Be Happy BVI. You'll hear much more about the program in the next few weeks. Keep checking our social media, BVI NHI, NHI BVI, on social media to get more updates. Until then, see you on the next NHI Chat.